Hi, I'm Maisie, and I first realised that I had scoliosis in the back end of 2023 when a colleague of mine realised that my back looked abnormal.
Hi, I'm Mr Prasad Karpe. I'm a consultant spinal surgeon at University Hospital Teesside. I'm also the pediatric surgical lead for James Cook Hospital. Scoliosis is a condition wherein a person's spine, instead of being straight, can get curved to one side. It can form either a C or a S-shaped curve. Primarily seen in teenage girls, it affects 2% of the population.
I was an asymptomatic patient and I had a curvature or a hump on my back. When I first found out that I had scoliosis and was referred to my scoliosis team, my surgeon, Mr Karpe, was the one who told me of the benefits of having the surgery and also to why many people do choose to it, and it was more of cosmetic side.
Not all scoliosis needs surgery. However, if the curve gets worse or it affects cosmesis or function, then surgery is recommended.
When I was first shown my x-ray here of what I had in my back when I had been just diagnosed with scoliosis, I was in complete shock to think that I could look like anybody else just walking through the street, but I have a huge curve in my back. I was completely shocked, to say the least. First of all, when I was first diagnosed with scoliosis, I was at one of the doctors where I met with a community physio called Sarah, and then after I was diagnosed I got transferred to North Tees to meet my surgeon, Mr Karpe.
Hi there, I'm Sarah Robson. I'm one of the paediatric extended scope physiotherapists who works in the community. I work across mainly North Tees Trust and have been working in the community for the last 15 years, working predominantly with paediatric patients who may present with any sort of orthopaedic, musculoskeletal and spinal issues. Within the musculoskeletal clinic, we will see birth to 18 years old, and we also see some orthopaedic patients. However, it was quite difficult to sometimes get these children seen amongst a number of consultants together in a multidisciplinary team setting, with us being based out in the community. We established this clinic on the back of Mr Page talking to me quite some years ago, having already worked with Mr Page for a number of years in the orthopaedic MSK setting, which we work at in the North Tees Trust.
So I'm John Page. I'm a paediatric orthopedic surgeon and I work between Durham, Darlington, North Tees, and Hartlepool and Sunderland. In essence, what we started probably 2.5 years ago was a combined service between Durham and more North Tees and South Tees. I've known Mr Karpe for many years, and on the back of his appointment in James Cook, I've been agitating to try and get some form of a combined clinic between North Tees, which is where I do a lot of the community work, and South Tees. With the support of the North Tees management, we eventually got up a MDT clinic, and that allows us to identify patients who are referred in the community and then have a very clear pathway with very clear SOPs to access the spinal clinic.
With Maisie, she came into my clinic with a shoulder complaint. The scoliosis was not necessarily detected until she had her screening, at which point we, following the assessment, arranged an X-ray and MRI scan. She did start some physiotherapy and was seen by Mr Karpe in the next available clinic and went on to have surgery with an excellent outcome.
I had a very smooth journey through hospital. My surgery was on the Monday and it went perfectly due to all the complex specialists in the surgery itself, but also those who were looking after me.
Maisie had a surgery 1 year ago by my team. She was a star patient when discharged third day after surgery, in spite of it being a complex surgery. We are one of the 23 centers in this country that do scoliosis correction for children. At James Cook Hospital, we have a dedicated team that comprises of pediatric spine surgeons, pediatric anesthetists, specialist pediatric nurse, and intensivists who look after these patients.
I think this is an example of how linking primary care, secondary care and tertiary care together really works, and hopefully over the next 6 months to a year we'll actually expand it into the County Durham and Darlington area, and then we will actually show just how well it works across trusts, not just a single trust.
Maisie is an excellent example how collaboration between the community, secondary care and tertiary care can lead to excellent outcome in short and long term.
My life has changed quite a lot. I've recently just finished my first year at university doing a primary education degree. I'm also 2 inches taller, which helped, and I'm starting to get back into the fitness that I love to do. There was lots of people who helped me during my scoliosis journey, but the main people that stood out for me were Mr Karpe, who is my spinal surgeon, Cheryl, who is the scoliosis specialist nurse, and Georgia, who was in the paediatric HDU ward. The first thing that I would say to anybody who has recently been diagnosed with scoliosis and the option of surgery is a possibility is do it. Just do it. I know it seems like such a scary thing and how big the operation might be, but it's changed my life forever, and I'm sure it would change yours. There seems so many scary words with what's been told to you, and it might seem really overwhelming, and it might take you a few weeks to decide whether you do want the surgery. Like I've said previously, the team who deal with you while you're having the surgery are fantastic. They put you at ease so much, and everybody included. It is a wonderful experience, really. And then to see the X-ray literally a day after you've had it done, it's life changing, and it's the best thing I've done in my life for sure. Knowing that you were a scoliosis patient or living with scoliosis doesn't need to impact your life at all. Having the right care and the right treatment can only positively impact your life further.
Surgery in the right indications leads to good outcome and improvement of quality of life in the short and long term.
My care was by far the best that you could receive. I will be forever thankful and grateful to those who have looked after me and corrected my spine.